Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
High blood pressure, diabetes, heart disease, autoimmune disorders. There was a time when being diagnosed with any of these meant a dramatically lower quality of life, especially for people living in their 40s, 50s, and 60s. But that story is changing. Today, we'll be talking about advances in medicines and treatments, nutrition, and lifestyle changes that can positively impact and make a difference in these disease processes, as well as answer your questions here on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage you, our viewers, to send in your health questions and our experts help answer them. My name is Dr. Kamaljit Kaur, and I am a primary care physician. Let's get right into our questions today. The first one comes to us through our website, allhealthtv.com, from Bobby. And Bobby is writing in to ask, "Hey doc, my wife has type 2 diabetes and I'd like to know, besides taking medicine, what's the most important daily habit for her to maintain stable blood sugar?" Hi, Bobby. Thank you for sending in your question. And I'm so glad to see that you're supporting your wife in her health journey because it is so important to have that systemic support. I think it's wonderful. And it's going to also ensure that she stays healthy and on top of her treatments. While there's many things that one can do to help manage their diabetes and manage their blood sugar, there's one that may stand out and it may even surprise some of you. Did you know that walking within 10 to 15 minutes of finishing a meal, especially a large meal, say like dinner, actually is one of the best things that you can do? This works well because it helps to prevent that sugar spike that happens in our body naturally, even in non-diabetics, after eating a meal. Here's the reasoning behind it. Muscles are the best utilizers and metabolizers of blood glucose, especially when the levels are high. By walking, you're going to activate those muscles. And what are they going to do? They're going to grab that glucose from the bloodstream, especially if it's running in high levels. The muscles are going to take that glucose and use it for energy. And if you're doing something that is energy requiring, like walking or exercising, then it's going to even be better used and better metabolized. And that's going to result in lower blood sugar levels overall. Walking really induces those muscles to work. And that's the best way to keep your sugars in a low state, not a bad low state, but in a good low state. So how much do you really need to walk, or what exactly do you need to do? It's not a lot. You'd be surprised. If you're somebody who doesn't exercise on a regular basis, or somebody who doesn't exercise right after meals consistently, even 10 minutes of doing so is going to give really impactful and positive results. So you don't need much. You can start with just 10 minutes. What are you doing for those 10 minutes? So you want to make sure that at the very least, you're walking at a brisk rate, at moderate intensity. And what does that mean? So that means that when you're walking, you're able to maybe talk and say a sentence, but you can't sing. So I know this may sound silly, but for instance, if you're walking, especially if you're on a treadmill or walking around the block, a lot of us like to wear headphones and listen to music. You might even find yourself starting to belt out the song or starting to sing along. Well, if you can comfortably sing along to the music that you're listening to, then you're not going fast enough. You might need to up the ante a little bit and walk a little faster. Now, remember, you don't want to go from 0 to 100. So please make sure, especially if you're somebody who doesn't exercise on a regular basis, that you're building your endurance up to this. So maybe for those first couple walks and even those first couple weeks of doing so, you're walking at a pace that's comfortable for you. And then gradually you start to increase and go a little bit faster and a little bit faster. You can also always ask your physician or a trained exercise physiologist for the best way to build up your endurance. So you make sure that you're doing things the right way, because even though you're doing them, if you're not doing them the right way, you're not going to get the benefits and you may even be at risk of injury. So you want to be careful about that. And if you do this consistently enough, along with all the other measures like taking your medications, making sure you're eating healthy, making sure you're not drinking alcohol, you're not smoking, your stress is managed, all of these things are going to work really well to reduce your blood sugar levels. And over time, you're going to even see a reduction in your hemoglobin A1C. And then that's going to mean that your diabetes is pretty well controlled. And most importantly, it's going to lower your risk of that diabetes going into a complicated state and going and turning into heart disease or kidney disease or something else more drastic. So, walking after meals, even just for 10 minutes, is probably one of the most impactful things that you can do to help manage your blood sugar. And like I said earlier, this is very important for diabetics, but everyone should be doing this and can be doing this. I hope that helped to answer your question. And let's get to the next one. This one comes to us from Sybil, and Sybil is reaching out from YouTube to ask us, Hi, Dr. Kaur. I was diagnosed with multiple sclerosis in my late 20s. My condition has been stable for many years. Now that I've hit my mid 40s, I'd like to know what I can do to keep the disease in check. Hi, Sybil. Thank you for sending in this question. It's so important. And I'm glad to hear that your symptoms have been well managed so far, and I sure hope it stays that way. So, what can we do to help ensure that it does? The best way to manage your disease, there's so many things that you can do to ensure that you do that. And some of them would even apply even if you don't have MS. But let's focus on multiple sclerosis and the things that you particularly can do. Of course, consistently taking your medications and following up with your neurologist is going to be so important, because you want to make sure that you know the status of your MS and if you're on the right medications at the right doses, and most importantly, if those medications are doing what they need to be doing and not causing you side effects. So that's probably the number one thing. The other thing I want to talk about, and one of the most powerful non-medication tools for MS, is something that I actually mention a lot: regular exercise. Why? Because we've seen that in individuals with multiple sclerosis, regular exercise actually improves your energy levels, so you feel less tired. A lot of individuals with MS will find themselves feeling fatigued throughout the day, even if they're not doing much, and regular exercise can help combat this. Also, regular exercise helps you preserve your mobility, so moving around, keeping your joints lax, keeping your muscles strong. That's going to be really important as well. And not just physically, but regular exercise also helps improve your cognition, your critical thinking skills, and your mood. Remember, when you exercise, your body's releasing happy hormones, and that's going to be good overall. The one thing that I want individuals with MS to know, though, even though exercise is wonderful, remember, MS is a neurological condition, and it affects a lot of different parts of the neurological system, including temperature regulation in some individuals. So, depending on how progressed your disease is, you may notice that sometimes you feel overheated or hot, or your temperature's dysregulated. Well, you want to keep in mind that when you're exercising, naturally your body may heat up. We start to sweat when we're really working out and we get hot. If you're somebody who has MS, you have to be really careful about this because you don't want to overheat. Again, if you have MS and you're trying to start a new exercise regimen, please talk to your physician, talk to your neurologist, and it would be a good idea to talk to an exercise physiologist as well. Again, to make sure that you're doing the right things the right way for the best outcome. What about sleep? We don't pay much attention to sleep, and I think that's really not a good thing. Sleep is so important in our body for many reasons, but we have also seen that not getting enough sleep or having bad sleep can actually provoke an MS flare. When you're sleeping, your body is in rest and recovery mode, and that's important for all your health systems, but especially your neurological system. So you want to make sure you're getting at least 7 to 9 hours of restful, uninterrupted sleep. If you're waking up feeling groggy and tired on most days, then that means your sleep is not restorative, and you may need to talk to your physician about what else might be going on so you get to good sleep. Stress. We all know that stress is not good for our bodies. It's not good for our minds. And unfortunately, I think everybody nowadays is at least somewhat stressed. I know you can't get away from it completely, but keep in mind that stress can also throw you into an MS flare, and it can actually cause a lot of inflammation in the body, which affects your neurological system as well. So, how do you combat this? You want to make sure that you're implementing stress reduction exercises, whether that means you're journaling, you're practicing mindfulness, you're meditating, or you're doing something like yoga or regular exercise, dancing. I mean, it doesn't matter. Anything that brings you joy and makes your stress levels go down should be practiced on a daily basis for overall health, but especially when you have a condition like MS. You want to avoid alcohol and avoid drugs and smoking. And I know some people may say, well, of course, that's obvious, but it does bear emphasizing because sometimes, depending on your disease progression and how intense your MS is, even a little bit of wine can be harmful and can provoke symptoms. So you want to be mindful of that as well. What about diet? We talk about it all the time. A healthy, nutritious diet, one that's limited in processed foods, processed excess sugars, and red meat can be very, very beneficial. Also, you want to think about the things that you don't want in your diet, but let's not forget the things that you do want in your diet. You want to make sure you're getting enough protein, you're getting enough fiber, and you're getting enough hydration. Those are going to be also very, very important. And since you mentioned that you're in your 40s, I want to also mention something that sometimes we forget. Women in our 40s, we may be going through a hormonal transition leading up to menopause, which is called perimenopause. During this time, your hormones are fluctuating, and they may not be fluctuating in a bad enough way that they're causing you symptoms, but the underlying fluctuations may still be there at a lower level. These can certainly affect the disease processes like MS, and it can actually throw you into a flare if your levels are really abnormal. So, what you want to do is, if you're a woman in your 40s, you want to at least have the discussion with your gynecologist and let them know that I have MS and I just want to make sure that whatever's going on in my reproductive system and with my reproductive hormones is not going to put me at risk for a flare. Doesn't mean that every woman in her 40s who's in perimenopause and has MS needs to go on hormone replacement therapy or anything drastic and concrete like that. But you want to make sure that your gynecologist and your neurologist are communicating with each other to make sure that they can help keep at least that aspect of your health at bay and it's not going to throw you into a flare. I hope that helped to answer your question, and I hope that your disease stays really, really low and your symptoms don't come out to play at all. Good luck. Let's get to the next question. This one comes to us from Rainey, and Rainey's reaching out to us through our YouTube page to ask, hi, Dr. K. I was diagnosed with Crohn's disease 10 years ago when I was 35. It wasn't severe, so I just dealt with the pain and discomfort. But now, 10 years later, the condition is getting worse. Any advice on what I can do to treat it a little more aggressively? Hi, Rainey. Thank you for sending in your question. I am so sorry to hear that your disease process and your Crohn's symptoms are getting worse. The first thing you want to do is consult with your gastroenterologist to find out why. Anytime any disease process gets worse or starts to rear its ugly head, the first question we as physicians have is, well, what happened in the body or what's going on? Why is this getting worse? Because that's really going to help guide our recommendations and what we need to do to help you get healthier. And one other aspect of it is that Crohn's is a chronic disease, like many of the other conditions that we've talked about today. And it can wax and wane. There are periods that it'll get better, it'll get worse, and sometimes you might not have symptoms for a while, and then all of a sudden they're back and they're pretty bad. That's okay. But if you're consistently getting worse, then that should prompt investigation. There's also a possibility that the Crohn's process in your body has changed in itself. So just because you're getting older doesn't mean that your condition is going to get worse. There might be something else going on. For instance, maybe after years of inflammation in the body, in your intestinal system, you've now developed scars or fistulas that are often seen with Crohn's, and that can provoke symptoms as well, especially really bad ones. So, like I said, if you're getting worse, we need to know why. If that's the case, then you may need a change in your medications, you may need an increase in your medication, or totally different medications altogether. Other than that, the most impactful thing that you can probably do to manage your Crohn's and prevent further inflammation is an anti inflammatory diet. One that's limited in processed sugars and red meat is going to be very important. And don't forget the fiber and staying well hydrated so things can move smoothly through your intestinal tract. On a related note, if you've been doing all the recommended things, you're taking the right medications, you're eating a nutritious, anti inflammatory, fresh whole foods diet, you're exercising regularly, your stress is low, you don't drink alcohol, you don't smoke or do drugs, and you're still having really bad symptoms, then it may be time to consider surgical intervention with your physician. Now, surgery for Crohn's is always last resort. It's not something that you want to jump to right away or that your physician is going to recommend that you do without cause. But it is something that may be on the table on the back burner. So it's something to think about. Again, it's so important that you talk to your gastroenterologist about what may be going on so you can really form a good plan of attack and get your symptoms under control and get back to being healthy. I hope this helps. Let's get to the next question. This one comes to us from Clay, who has reached out through Instagram to ask, Dr. Kaur, my mom just found out that she has rheumatoid arthritis. The initial advice given to her sounded kind of counterintuitive. How can movement like swimming, yoga, and walking actually reduce pain instead of worsening it? Hi, Clay. Thank you so much for reaching out to us with your question. I can see why this may seem counterintuitive. When we think of moving and exercising, we usually expect to be sore afterwards. However, have you heard of the phrase, use it or lose it? Well, that describes this situation perfectly. Let's back up for a second, though, and talk about something really important when it comes to rheumatoid arthritis. Unlike regular arthritis, which can occur due to wear and tear in an aging body, rheumatoid arthritis is due to an inflammatory process in the body. This often results in people wanting to move less because you're in pain, your joints are stiff. So the first thing you think about is not exercise, it's not let me get up and walk around, and that's understandable. Now, when you move less, your joints stiffen even more, your muscles stiffen even more, and then that just makes the situation even worse, and it can result in more pain and less mobility. However, with exercise at a level that is comfortable for you, those joints will begin to loosen up. The fluid around the joints will begin to circulate and lubricate the joint, kind of like WD-40 on a hingy or a rusty hinge. And all this circulation and mobility will help keep you flexible. And when your flexibility increases, your pain will decrease as well. This all comes together to decrease those symptoms of rheumatoid arthritis. The other important thing that exercise does in the body is it reduces your inflammatory chemicals. So, exercise is the most natural anti inflammatory thing that you can do for your body. And for obvious reasons, that's going to be wonderful for rheumatoid arthritis and reduce the symptoms related to it as well. So as you can see, moving appropriately is going to be key. Use it or move it or lose it should be the mantra here. I hope that helps. Let's get to our next question. This one comes to us from Everett, and Everett is reaching out from Facebook to ask, Dr. Kaur, my father has coronary artery disease. What lifestyle changes would benefit his particular condition? Because it is so important to make sure that your chronic conditions are being looked at and evaluated and treated from a holistic or integrative point of view. We have to look at all aspects. Let's get back now to Everett's question. Everett was asking about coronary artery disease. And I'm glad that you recognize, Everett, that there are a lot of lifestyle measures or a role for lifestyle measures that's going to be important in the overall management of heart disease. Unfortunately, this isn't talked about enough sometimes, and it can be one of the most effective ways to help your heart stay healthy or to help your dad's heart stay healthy and prevent complications like heart attacks and strokes. The lifestyle changes that will be most impactful are the ones that I talked about a little bit earlier and talk about often. Let's go into those details. Exercise. Now, when done properly, exercise helps the heart become stronger, more efficient, and a better pumping machine to allow healthy blood flow to all the important parts of your body. And this will naturally help keep you healthier. It does this by training the heart. So the heart is a muscle. And just like when you're lifting dumbbells to grow your biceps or to improve muscular health in other parts of your body, training appropriately is also going to help strengthen that heart muscle. And that's going to become a better pumping machine. It also helps the heart arteries stay flexible. One of the things that happens naturally to some degree as we age is hardening of the heart arteries. And in conditions that are inflammatory, like heart disease and diabetes, but certainly coronary artery disease, that inflammation is a little bit more accelerated, and that inflammation causes those arteries to become more stiff and more prone to disease. By exercising, you're increasing the flexibility of those arteries, so they're going to be more friendly to the blood flow and to allow blood flow through the heart and other parts of the body. And they're going to be less likely to go into complications like heart attacks and strokes and blockages in the arteries. Also, did you know that regular aerobic exercise can also help grow new arteries? This is something that I like to tell my patients because it is surprising, but it can happen. So when you have your heart arteries, and some of them are clogged, especially if some of them are significantly clogged, the blood can't flow properly through them. And the body, if it's in a state that's well enough to do this, will recognize that and start to create little arteries around that clogged artery so the blood can bypass it and get to where it needs to go. It sounds pretty cool, and I love that our bodies are just so amazing that they can actually heal themselves if we give them the right tools to do so, and exercise is one of the best ways to do that. Nutrition. Talk about it all the time. I've said it a million times probably on this episode. A healthy diet helps provide your body with all the nutrients that it needs to stay working at its best. And sleep. Remember, I mentioned that rest and recovery mode? Well, that is so important when it comes to heart health because poor sleep increases stress on the heart, increases inflammation in the cardiovascular system, and that's going to be a bad situation overall. But if you're sleeping well and you're getting healthy, restorative sleep, that's going to slow your heart rate appropriately. It's going to drop your blood pressure appropriately, and it's going to release or reduce the release of stress hormones throughout the evening and night hours when you're sleeping. Stress hormones, as the name would imply, are very stress-inducing, especially to the heart and cardiovascular system. Now, throughout the day, we're at work, we're running around. Most of us are stressed to some degree, so we probably have a little bit of those stress hormones elevated and running through our body. But we need to give our body a break, and sleep is the best time to do that. So we need to make sure we're getting restorative sleep so those stress hormones can calm down. Anything that's inflamed in the body has a chance to recover and repair, and so we can continue to be healthy for the next day, wake up, feel energized, and go about our day. Similarly, we want to also recognize the avoidance of risky substances, alcohol, nicotine. Nicotine is very inflammatory and bad for the body, so you want to make sure that you're avoiding that as well. All those things can be put together and done gradually and in a regular, consistent basis to ensure good heart health and so that your disease is not progressing and resulting in a heart attack or a stroke. As you can see, there's a lot that we can do to keep ourselves healthy, even if we've been diagnosed with a chronic condition. A lot of times that's going to include not just your own knowledge, but gathering knowledge from health experts like your physician, an exercise physiologist, a dietitian, and maybe sometimes even a psychotherapist to make sure that all parts of our body are healthy and that we're doing what we can to prevent any complications of our diseases. I enjoyed answering these questions for you today, and I look forward to seeing you here next time on Ask the Doc. No appointment needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.